Welcome to Fuller Butts, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butts, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Drs. Fuller and Butts will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butts podcast will surely satisfy your podcast fix.
All right. Welcome back to the Fuller Butts podcast. I'm Dr. Daniel Butts, and with me, Dr. Sam Fuller. It's been a minute. How have you been?
Doing great. This is our mid-year summer soiree of podcast episodes. So excited to be back on the mic talking about some interesting topics. And summer's going by fast. It's been busy. It's been a lot of fun. How about you?
Same. Yeah, super busy. Summer, sometimes I normally get a little bit of a lull where I can enjoy myself, but this summer's been kind of just continuing on at a breakneck pace. So it's good. Can't complain about that, but also trying to enjoy some of the nice weather we have here in the Midwest for a change before the winter comes back.
Yeah, World Cup fever.
Yeah.
Got a lot of great things to look forward to. Things that you want to look forward to are great. Things that you want to look back on and feel like you could do differently is not so fun. And so today's topic and episode is on regrets with plastic surgery. Dan, do you want to talk through what the plan is for this episode?
Yeah, so we were talking about, just patients and experiences that sometimes people have and kind of how they could, how you can avoid some of these scenarios and, some regrets patients might have going into it. Just kind of thinking about these kind of three main regret categories that patients often fall into. And you think you can, jump into your first one. Like, what is a common thing that patients often regret when choosing or deciding on plastic surgery? What can that kind of lead to?
Yeah, so we're going to break it down to a couple of topics. I think I just want to kind of get out in my mind maybe like what our biggest regret in a patient that we've faced, and that might break down some of the reasons why people have regrets regarding plastic surgery. I have one that is just fresh in my mind. Wouldn't say it's necessarily like the worst or the biggest, but I would say it's something that really is poignant for some of the topics, and that's a patient that I'm currently treating as a revision who opted to go out of country for their plastic surgery. So went to the Caribbean, got a full tummy tuck and BBL, high volume fat transfer to the butt and thighs, and saw me about a year after surgery. Overall, had a good experience there. Felt like the care was appropriate. Stayed there for several days afterwards, but was in pain, was sore, and had very limited follow-up afterwards, and came in just saying that the BBL is just way too big. She feels, very uncomfortable, very self-conscious, doesn't want to wear certain clothing, and, has considered it and her options extensively and wants a reversal. So wants to have fat removed from her. And so, I met with her and discussed all the options, talked about that pendulum swinging back and forth. And before I go on, I'll just pause, Dan, see if you had any questions. You have any similar stories to share regarding this type of situation?
Yeah, I mean, the first thing that I kind of thought you were going to tell kind of a little bit of a worse story of a bad infection and not having proper follow-up care. So, all things considered, you're just having too big of a BBL, especially with kind of tourism plastic surgery, she probably was fortunate that she didn't have kind of major consequences, but definitely, let you, finish the story because, choosing a surgeon based on price alone, a lot of these times you're not even meeting the doctor until the morning of surgery and very little kind of contact afterwards when you kind of, you're choosing these, kind of budget places, whether it's in Miami or the Caribbean, you often have less control over who's actually doing your surgery.
Yeah, it's interesting. There's also a patient who reached out with multiple seromas or fluid collections from her tummy tuck that she had done in Miami, and she called her doctor, and they recommended that they see someone local and like, hey, why don't you fix this? And there's plenty of those, and hopefully we can talk about those in your portion of things, which is just frustrating, and it really makes me wonder, like, how do they find this doctor in the first place? Are they choosing a center? Is it like an ad? Is it, how are they getting to go be in another country, not ever meeting the doctor who's going to be treating them? But in this case, scars, on assessment were okay. The scar lines were okay. The tummy tuck was done fine, but significant fat transfer to the butt and thigh area. And after meeting with her several times, and quoting her as if it's a first time surgery, this is not my revision, it's her new surgery, so she's now paying probably almost double of what she could have paid by just having it done locally, or potentially not as dramatic. Removed over 800 cc's of fat as part of her reversal or reduction. Did have a couple small dog ears, some scars that she wasn't happy with. She did have a small opening or wound in the center point of the tummy tuck, which I was able to revise for her. She's pleased. At this point, she's about 3 or 4 months out, still waiting for some of the swelling to go down. She's still, considering having even more reduced. I told her I didn't want to swing it so much and take everything out that she loses what she had. Did not want to be drastic and leave her with fluid pockets or seromas or laxity of her skin. So I still think if I throw out a number of like taking out over 800 cc's of fat, you would say that that's a pretty good amount. But still, I think improved it to a point where it's proportional. She's feeling more confident. But it's one of those things where, when we talk about regrets with plastic surgery, going out of country to have a dramatic change to your body and then not being happy with that, and then needing to spend more time and money to have that corrected, certainly is up there for me.
Yeah, it might also kind of fall into this, plastic surgery trends which I think we're seeing a big shift of, is these really big BBLs are starting to fall out of trend, which I think is great because they have more safety issues and more risk for fat necrosis and seromas and issues. But then the consequences of these overfilled BBLs, which is again was kind of trendy, and now more appropriate smaller BBLs are kind of coming into vogue. So not chasing the social media or a plastic surgery trend, but really trying to find something that's just proportional and natural. It's going to fit your frame and be a long lasting result, not a temporary result. It's almost a secondary kind of regret that.
Yeah, I think it was fortunate in this case. She actually came to see me for a consult before she opted to go out of country. And so we had that doctor-patient relationship beforehand. So when she came back to me, it was sort of like, well, hey, so I did a thing and what can we do? And she's been great, has a great attitude about it, trying to set realistic expectations, telling her that, it's going to be really hard to get exactly what she wants, but if we can get improvements, that's what our goals are. What about you? What kind of regrets have you seen?
Yeah, I mean, it's kind of similar and kind of, not, price shopping and kind of like going for a less expensive option is similar. I saw a patient for a consult. It was a mommy makeover, reduction, tummy tuck, liposuction. And, she opted to go elsewhere where she could use insurance to pay for the reduction. And then, came back about a year later with, a lot of asymmetry, not as small as she wanted to be, kind of poor scar placement and kind of a lot of, just not, great, results compared to what I typically would be expecting for someone like her. And so we ultimately went back and kind of did a pretty large breast revision to get better shape and get her smaller, more proportional. Try to lower her scar as much as I could. Again, there's also sometimes a limit to how much lowering you can do, and did some tweaking of other things. And it just goes to the same point. Like all of a sudden you're having 2 surgeries, and those revision surgeries are often more expensive than the primary one would have been because it's more complicated. And I just feel it's unfortunate that they aren't happy with their first outcome. We want patients to be happy is number one thing. So seeing them come back kind of having gone through that recovery, gone through the expense of it, even if it is less, is still just kind of feel bad that they kind of had to have a negative experience. But then also, fortunately, you can try to improve upon as much as you can. So I think that's a big thing. Is sometimes you kind of pay for what you get in a sense. And I feel like there has been a little bit of a pendulum swinging. I've seen some pretty outrageous prices being, kind of posted online about things. So, it's not always the highest price thing is the best. But you want to do your research and really, get, like you mentioned, develop a good rapport with your surgeon, see a lot of their results, make sure you're going to get what you're paying for, and that's the result you're looking for. That's going to be long lasting as well.
Yeah, your last couple minutes were so key, in that price shopping is, there's a pendulum, so you can look for the most outrageous, go to big time cities. It's almost like a competition who's charging the most versus trying to get these cut rate. Oh wow, it sounds so good to be true. There's should be some red flags and warnings. You want to go to board certified, reputable surgeon. You want to see their before and afters, understand them, meet them, develop a relationship with them. And so, in your situation, it's more of price points, trying to find something cheap, and whether it sounds exotic to go someplace. I'm going to Miami. I would say, just to proceed with caution. Now, there are great surgeons everywhere. There's great surgeons in other countries. There's not so great surgeons here and in other countries as well. So that's where it's really the patient doing their homework to avoid the regrets that we're talking about. Another regret that we see is really with what the results are in terms of expectations. Do you want to talk through what we mean by that?
Yeah, so obviously you come in to plastic surgery because you want to change something. You have a vision of what you're kind of hoping to achieve. And I feel like I see this less so now, thanks to GLP-1s. But years ago, patients would come in with a higher BMI, and they had a lot of loose skin, overhanging, whether it's an apron, and you can make a big impact on how they feel, how they fit in clothing at a higher BMI. But you're probably, like we often say, we're not changing. These aren't weight loss surgeries. We're not going to change that BMI all that much. But getting rid of that loose skin, that overhang, that rash can still make a big impact. But routinely, I counsel patients on, we can do this surgery now, but if you're trying to lose weight, if you want to get a better outcome, losing 20, 40 pounds can really make a big change. And again, now thanks to GLP-1s are often able to do that more efficiently than they once were. But it was, they come back and their BMI hasn't shifted much, but they look a lot better, but it's not what they kind of envisioned of them, being tinier. So I think that's one thing. I think you had another great example as well, or kind of just general concepts about this. What were we talking about before?
Yeah, it's such a common thing where, we're talking about patients, and I'm so many times telling them that, plastic surgery is just not an urgent matter. It's not a weight loss tool. And for patients who say, yeah, I'm right about there, after this surgery, I should be at my goal, kind of pause and say, hey, wait a second, like this isn't meant to get you the last 5 to 10 pounds. And if you are aiming to lose, more than 15 pounds, it's going to affect the results. And not just crashing down to your lowest weight and then immediately having surgery the next week, but really being stable at that weight, to know that you can manage yourself at that weight, and to really let your body recoil in a way from that, weight loss, to allow the tissues to get to a baseline, to make things really reasonable as far as what the expectations are. And there are patients who I wouldn't say it's body dysmorphia, but it's really just what their goals are and what they expect their body to look like. I'm more inclined now to bring them over to the mirror in my room and really kind of pull down and show them and point out stretch marks and point out different areas, like, hey, this will still be there, this will be lower. You're not going to be able to see, a six pack in certain cases and situations, just to let them know. And oftentimes, majority of the time, really patients are like, oh gosh, I know, I just want all this loose skin. And it's really just us talking, us having that conversation out loud to make sure that we're both on the same page. And really, they can point out things that really bother them, like, hey, will this be gone? Yes or no? And we can kind of talk about that stuff. I think that there's lots of variables that are out of our control, such as age, the amount of weight loss that happened, other medical issues. If somebody comes in and they're 70 versus 30 and they've lost 100 pounds, I would expect, the results to be different. And you just want to make sure that the mindset that you have of what you envision for what the aesthetic is, but also what the rationale is for the surgery are reasonable, so that expectations don't leave you with regret.
Yeah, absolutely. I've seen this a lot too with goal photos, which I often do request for breast augmentation, just to kind of get a sense for what they might be wanting. So some people say a C or a D cup. Like, what does that actually mean to you? Natural versus more enhanced. What does that actually mean to them? Do you see that a lot too, or do you have patients kind of coming in with photos that just won't be able to actually achieve?
Yeah, I kind of stole the line from you, and I kind of tell them that the goal photos are my least favorite or least important tool that I use in terms of measuring and really kind of understanding what their sizers are that I use. But it's still an important tool, I think, to reason out some of the expectations, because if they're showing me individuals, models, bodies who have no breast and it's all implant, and they are going to have a small implant, a majority of breast, it's really that ratio that I'm trying to talk to them about, that, hey, yours is going to look a lot more natural. That patient has a different body type than you, or you're saying you want something very natural and subtle, but the pictures you're showing me are extremely large. Those are important, just so that we get the verbiage and the vocabulary right, so that we're speaking the same language. I think it's helpful when I point those things out. Sometimes pictures are worth 1,000 words, where I say, hey, this picture is probably enhanced by the bikini, and if we took the bikini off, it may look different, it may look lower, and to kind of show them where their footprint is on their chest wall in terms of where the implant's going to be, I think is very helpful. And just to point out, like, hey, that's a great result. We can aim for that. Yours is going to look different in so many ways, or it's going to look very similar to that. If we use a certain profile, I think they can be helpful. So it's a tool to use, not to overuse or rely on solely, but it's definitely something that comes up for all specifically the breast augmentation, breast augpexy cases that we do.
Yeah, for sure. I've had a few patients try to bring them in for body surgeries, and then I'm always just like, it's everyone's baseline anatomy is so different in that sense. So like trying to choose, someone with, again, like totally different height, weight, shape. That's not what we can really do with plastic surgery.
What about for your tummy tucks and the massive weight loss? As long as we were talking about them, in deciding between the open book or the fleur de lis, that vertical scar, because there's a couple tweeners where I'm like, hey, you would really get the best result in the horizontal and the vertical vectors by us pulling it together, but you're gonna have a scar going up and down your belly. And really, to help the patient make the decision, how do you approach that? Do you make it for them? Do you show them pictures? Do you kind of go through the pros and cons and help them? Like, are you okay with a little bit of baggage, a little bit of laxity without the scar? What's your consult room look like in those situations?
Yeah, that's kind of the latter there. I show them examples, and I kind of pull down and say, like, listen, we can pull this down, but you're still going to have this upper laxity kind of going side to side. Fleur de lis would help address that more. In the open book's pretty selective. You have to have kind of this extra roll up top that the traditional techniques won't address. Showing them examples and say, like, is this, you need to be prepared to have some laxity up here, or you need to accept having a scar here. And for some patients, if they already kind of have a vertical crease just standing, like, well, you kind of need this. So they're kind of two different categories. Those in-betweeners that can get a great result without it, but may get a better result, but with the trade-off of the scar, kind of just being upfront about that. And sometimes those in-betweeners say, well, you can always do this later if you decide that it does bother you enough to justify that scar. Because frequently there's multiple stages to these surgeries or these patients where they need arms or thighs or things done. And it's pretty easy to add that in secondarily if they're not satisfied with how tight that became.
Well said. Should we wrap up with the regrets?
Yeah, number 3. You want to take this one?
Oh, I thought we were wrapping up. What else are we doing?
We're done? Thought we had a third one.
Yeah. So you had a better example. We talked about this a little bit pre-show, sure. But we're talking about regrets as far as how the patient can affect the results. So I feel like this may be the most disappointing is when the patient actually affects their outcome with certain activities, hobbies, recreational uses. You had
Yeah, I remember one time you said you wish you could put patients in a bubble for 6 weeks and just let them heal, and you can't do that. So we provide all this guidance and recommendations. We encourage them to follow it, but ultimately it's up to them to, follow our guidelines and to allow things to heal adequately. I really try to stress that like surgery is just one part of your outcome. This 1 hour surgery or 3 hour surgery can only do so much. You need to then heal properly. There's one example where the patient was feeling great afterwards. It was a tummy tuck, muscle repair, breast lift. She was just, I think, 4 or 5 days after surgery, and she had done a great job quitting smoking leading up to it, but then started smoking and decided to paint a bedroom with a bunch of arm stretching. Fortunately, she didn't have any major wound healing issues, but she did develop a small hematoma, kind of also the breast swelled up kind of on one side of it. We were able to, fix it in the office relatively easily, but it was still like a setback. There was discomfort, extra visits, extra kind of care that was required that would have had a much smoother outcome. So I always tell patients, really try to invest in your recovery so you don't have setbacks and make it as efficient as possible. Because if you push too hard, you often can delay it. So again, that's obviously the patient regretted afterward. We apologized for painting the bedroom 5 days after surgery. Unfortunately, the smoking wasn't as consequential as it could have been, but probably didn't help either.
A patient who called frantically 2 to 3 weeks out, was putting on the fitted mattress sheets in her bed and, kind of tore the breast aug incision, which is small, but, came in panicking and rightfully so, was able to calm her, reassure her, was able to treat it locally, topically, did not have to go back to the operating room. Thankfully, was able to heal well with a appropriate scar, but really harp on investing in the recovery time, not just the surgery day, as you said, especially this time of year. It's summer, there's pools, there's lots of outdoor activities. It's 90-degree humidity. So I really caution them that, air conditioning and as much as patients are just as attached to their workout routine, their exercises, it's what keeps them healthy from a mental standpoint. I'm really just trying to tell them that if you just shut it down for a few weeks and just let your body heal, focus on that nutrient, the wellness, the sleep, the recovery, you will get back up the speed faster. You'll get back to your level of competition and exercise, but we just got to let the body heal, because all of that friction, that motion leads to excessive swelling. It leads to healing issues, blistering. And, there are some patients who admit it, like, oh, I probably shouldn't have done X, Y, or Z. And I'm like, yeah, that's a pretty big reason why, we're here. And we just don't want to have those, conversations of regret as best as we can.
Yeah. I think that covers some big things, some things to be prepared for, doing research up front, making sure you're doing the right surgery with the right surgeon. Unrealistic expectations are so important, and then following, instructions afterwards. You kind of avoid those 3 regrets. I think likely a very high chance of having a great outcome and being very happy with your outcomes.
Yeah, find a board certified plastic surgeon, reputable location, someone that you have a rapport with. Don't price shop. Sometimes if it sounds too good to be true, it probably is. You want to do what's smart and best for you. Look at the long-term plan, invest in your recovery, and live life without regrets.
No regrets. All right. Good.
All right. Great episode, Aaron. Good to catch up.
Talk soon. Yep.
All right. See ya.
Thanks so much for tuning into this week's episode of Fuller Butts, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butts are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButtsMD. That's Butts with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butts.